Welcome Mommy to Be. Please subscribe to never miss a Mommy Basics video. Your second trimester officially started this week. Your baby is growing fast, and has now reached the size of a nectarine. A very cute milestone this week is your baby can now suck his or her own thumb. This is one of those things that you might get lucky enough to see on an ultrasound or even later in your 4D scan, that will just make your heart smile. Your baby's brain has now developed so much, that your baby can now use facial features like frowning, and grimacing. Think about all these cute and crazy face expressions that will soon become part of your everyday life. Important and complex parts of your baby is busy forming already this week. For example, the spleen is starting to produce red blood cells, while the liver is starting to produce bile. The digestive system is also starting to develop. An important milestone this week is your baby starting to get little bit of hair. On your baby's body there is also very fine and small hair sprouting from the thin skin. This is known as Lanugo. This fine hair appear to keep your baby warm while swimming in the amniotic fluid. Most of it will be gone by the time baby gets born. It is almost impossible to believe, but your baby is already very active. You won't be able to feel these movements for another few weeks, but at week 14 your baby is moving about every 5 minutes. If you are one of the lucky ladies, you should start to feel less nauseous and tired by this stage of your pregnancy. The second trimester is known as the trimester where you feel the best. Most women also start to show by now, but because you are still quite small, you probably won't be uncomfortable as yet. Even though it is nice to not have so many bathroom trips anymore, you may still experience some unpleasant symptoms like constipation and dizziness. One of the perks of pregnancy is not having to deal with your period. Instead, you will have to deal with a milky white vaginal discharge. This is another pregnancy symptom that does not get better by the second trimester, and could actually get more as your pregnancy progresses. The vaginal discharge is caused by an increase in the hormone estrogen. It usually has an egg white color with a mild odor. The discharge is perfectly normal. In fact, it is actually a natural way your body protects your baby from infections. It is important to practice good personal hygiene, by changing your underwear and panty liner often. It is also recommended to wash your intimate areas with water only, and not with harsh soaps. Another problem during and after pregnancy is saggy breasts. This is mostly caused by genetics. There are however a few exercises you can do to help prevent saggy breasts if your doctor says it is safe. Exercises that can help with saggy breasts include chest press, push-ups, and cardio, for example jogging or walking. Something to consider adding to your diet is a daily glass of milk. As long as the milk is pasteurized, it should be safe to drink. Milk is rich in calcium, minerals, and vitamins, and therefore a healthy option to consume during pregnancy. Thanks for watching. Good luck with your pregnancy journey.